different medical needs. So I kind of take it in categories here. The first medical need to talk about is mobility. And we think of that immediately as people in wheelchairs who can't get around as well as others, but it's also people who might need walking assistance like a cane, something to steady them, but they're not as agile as they could be. A dog can really help with things such as picking up objects, opening doors. They can be taught to tug open a door so a wheelchair can go through, or the person doesn't have to worry about balancing the door and trying to walk through. The other part of that is a lot of people are self-conscious who have mobility needs. They feel very different than the rest of the public. And a lot of times when people are talking to them, I've heard patients say, I don't like that attention because I already feel different, and now they're talking to me about my disability. It makes me feel different. I've now heard those people who have the dog say, well, yeah, people do talk to me, but it's focused on the dog. And suddenly I'm not feeling self-conscious because I'm talking about a common interest of a dog, and my disability disappears when I talk to that person. It makes me feel more whole. So again, with mobility, obvious things of helping someone get around, but that social aspect is clearly there as well. I think the next category of service dogs that I've seen help with is what I would kind of put the psychological, neurological category. Psychological, children with autism is a really great example. A parent of a child with autism finds himself, herself constantly vigilant about the child's welfare. And they are sometimes even not wanting to leave the same room as their child for fear that the child would do something like repetitive head banging or other behaviors that are not healthy for the child. A dog can really help because the dog is with the child. The parent can relax and do the normal things such as fix dinner. The other thing that I think about are children that I've seen who have had wandering off issues with their disability. And parents get very nervous about that. Well, if the dog is with the child, the dog is going to keep the child in the range for the parent. And again, these are things that allow the parent and the whole family to have a more normal life. I think I've mentioned autism. There's also the social aspect of children on the spectrum, but maybe a little more toward the Asperger's side. So very intelligent children, but perhaps not as able to communicate in the way that most people are accustomed. But now there's this dog, and the child can wax very eloquent about their dog, and everybody still likes to hear it instead of talking about the stats of baseball for the last 20 years. I've seen that as well, and it's just very helpful for those kids. In the adult world, we often see people with post-traumatic stress disorder. Soldiers come to mind, or other people who've had a very significant traumatic event. And this disease is very debilitating. It's like having an anxiety attack often, and heart racing, and blood pressure goes up, and feeling nauseous, and all of the things that happen. And the triggers can be so very subtle depending on what caused the event. Having the dog with a veteran, for example, can really calm that person. They have that constancy there. Sometimes that has been used to be a family member. That's very hard on the family member to always be that constant rock for a veteran, but a dog can be that for them, and they can then have a more normal relationship with their family. So I think that's something that's helpful. I also know of dogs that have been trained for seizure alert. There is not as much in the literature about the success of those dogs as in some other medical conditions, but nonetheless there have been reports of dogs not only notifying someone if their person has a seizure, but also preemptively notifying someone that a seizure is going to occur. And I think we need to understand more about that and how to train those dogs, but again, that's there. So that kind of leads me to the other category which I want to talk about, which is medical alert dogs. And Medical alert is anybody who has a condition that causes an acute problem that could actually hurt them. So the disease that comes to my mind, I talked to you about seizures, and that's not as known to me, but the disease that comes to my mind, of course, is diabetes. I'm a pediatric endocrinologist. I take care of children who have diabetes. As part of type 1 diabetes, we have to treat them with insulin, and we want their blood sugars to be as normal as possible. That means that they're going to have some lows. And why do I say that? Because the insulin that we have is not perfect. It's not like our body that matches everything we eat with the exact right amount of insulin. We're trying our best to do that. But to keep good, tight control so that that patient doesn't have complications when they get older, like eye disease and kidney disease, we sometimes find that they end up with low blood sugar. And that has its own set of problems. In a child with a developing brain, there have been studies that show that they may not learn as fast as their peers. That's just one thing, but think about it on the chronic level. So you've got a person who has low blood sugar, and that person doesn't have any way to recognize it for themselves, and they get lower, lower, lower. Eventually they pass out. And if no one can come to help them, they could actually die. So why do I say they wouldn't recognize it? Well, our body has all these hormones that are entrained in our body to trigger when our blood sugar drops. Things like our fight or flight hormone, epinephrine, helps us. It's what causes your heart to race and those kind of things when you're low blood sugar. Cortisol is another one. Growth hormone is another one. Unfortunately, when someone has had type 1 diabetes for almost 7 years, those hormones they're not as reactive to the low. So you don't feel the low like you did when you first had diabetes. So when we teach new patients about diabetes, one of the survival skills we teach them is how to recognize low blood sugar and how to treat it. And that works really well as long as you can recognize those symptoms. But when those symptoms no longer occur, the best of all patients could be sitting here talking to you like I am and passed out the next. And so where a dog can come in there is because we know the dogs smell something. We aren't quite sure what it is, but we have numerous now, both case study reports as well as more thorough medical reports of dogs actually sensing the low blood sugar in a patient, notifying the patient or a caregiver or a loved one of the patient that the patient is low so that an action can be taken, which is giving glucose in some form, so that the blood sugar comes back up before anything severe happens to the patient. I have seen this work with people who have received trained dogs. I have also seen my grandmother's dog do it, had never had any training, which is what got me interested in the field in the first place. I do believe, though, that we need to be very careful when we talk to people about having a diabetes alert dog. People would love for that to work, and it does work, but there are also people who do not do the proper training of those dogs, and we need to not have patients that aren't vetting what's being done to have the dog trained. If it's a kind of a buyer beware situation, that there are good dogs out there and there are really good trainers out there, but they're scammers too, like in other fields. Only this time the stakes are so very high because it could potentially really hurt someone. So my mission in life and hope is someday to identify what the dogs do, smell, and someday to have a certification process started in this country, and hopefully some standardized training methods that will help everyone.
What are the benefits of a dog versus a medical device? Because there are numerous ways to measure highs and lows in glucose levels. So what does a dog do?
Well, that's actually a very good question. So the first thing I kind of talked to you about is that people have hypoglycemia unawareness. So normally if a person is beginning to feel funny, feel like they're low, they check their blood sugar, they find out they're low, they treat themselves. But if they don't have those sensories of being low, then they don't necessarily go around checking themselves every 10 minutes. So they're not going to pick it up. There is another device on the market called a continuous glucose monitor. And that works pretty well to tell people their trends. So when I have patients that wear them, they can see where their body's going. If they get a certain number and they look back, they can see 15 minutes ago, I was either higher than this number or lower than this number, and you get a sense of a trend of where you're going. But notice I said 15 minutes. That's about the lag time for a CGM. We've seen a lot of anecdotal reports, again, not scientific reports, but anecdotal reports that the dogs are alerting before the CGM. And that's an area of research that I'm still continuing, is to look and see when a person who has a dog also has a CGM, is to track how that dog is alerting in comparison to what their CGM device did. And I think that that'll help us understand. Now that is all the scientific part of the dog. There's still this social aspect of a dog, and I'm not advocating that people go out and get a dog because it's all social, but there is something, especially for young people who feel very different because they have diabetes. It's an awful disease. They have to be safe, they need to tell their coaches, they need to tell their friends. Sometimes their parents are a little nervous of them going out to camps or going to spend the night. The dog is there, and if it is a well-trained dog, is trained to go get help, and it's also trained and can be trained to provide that help in terms of bringing that juice box to the patient or to the parent to remind them what needs to be done. So I think that social aspect of the dog kind of not just recognizing the problem, but perhaps helping solve the problem is very unique. I'm going to tell you one story because I know that this patient won't mind me sharing it. He was a student at college, and he had a severe hypoglycemic episode. Now mind you, this is a young person who was climbing mountains, rappelling, very, very active. The hypoglycemic event that he had was so significant that he ended up with motor impairment in his legs following that episode. His parents, rightly so, were very concerned about him living so far away from home to be in college, and they were on the brink of wanting him to pull him out of the college. Because this person got a dog, he was able to graduate from college and graduate school, and is a successfully employed person at this point in time. Who knows if he'd have been pulled out of school, what would have happened? He could have become so very discouraged. He's a very wonderful person. He may have gone on and gone to school, but it certainly would have slowed him down. The dog was allowing him to make that transition from a very independent young person to a little bit of dependency, but not having to be dependent on parents, and being able to self-correct. His blood sugars, because I saw them, really improved after the dog. Again, I want to say that the future of this field is research, and it is important that good trainers unite to help each other know what is good training, and hopefully someday to have a certification process. Thank you.